Good morning, and thanks everyone for attending this morning's hearing. I know it's been quite challenging, a lot going on around here in these last days of governance here at City Hall and within the New York City Council. The other members of the committee will be joining us as they are in a conference which they're obligated to be in, and I could no longer prolong this hearing, so we're going to begin without them. And once again, good morning. I am Councilmember Nick Miller, and I am the chair on the Committee on Civil Service and Labor. I want to welcome everyone here to the Civil Service hearing this morning. This morning's hearing is on COVID-19 workplace safety protocol. 8 years ago, I had the pleasure and honor of being appointed as the chair of the Committee on Civil Service and Labor, a wonderful opportunity for me to continue to demonstrate my advocacy on behalf of New York City's workforce. As many of you may know, I previously served as the president of the Amalgamated Transit Union prior to my tenure in the council, where I fought to enhance protections for transit workers and workers in general. So it is fitting that my last hearing here in the council as the Committee on Civil Service and Labor also tackles these issues. Fitting, but at the same time, we're still doing it. During my tenure as the chair, we passed legislation, just cause protections, fast food workers, expanded health insurance for survivors of those who died during 9/11, related illnesses, exposed gender gap and pay and gender gaps in the workforce, compensation, and many more. These legislative achievements laid the groundwork for our biggest challenge yet, overseeing workforce protections for New York City's workforce during COVID-19 pandemic. The ability to work from home often is reflective of race, gender, and class. According to March 2020 report of the City Comptrollers, more than 60% of all frontline workers in New York City are women, including 81% in social services and 74% in healthcare. Additionally, 75% of all frontline workers are people of color. Specifically, there are more than 40% of transit employees that are Black, while 60% of the cleaning workers are Latino. Lastly, more than 50% of the frontline workers are foreign-born, including 70% in healthcare, 53% in food services, and others. This racial divide only compounds existing structural disparities that further exacerbate how people of color were impacted by the COVID-19 pandemic. Since our last hearing on workplace safety protocol in January 2021, the city has made tremendous strides towards a safe return to work. The administration has adopted a workplace safety plan for the city's agencies and expanded paid sick leave laws for the private sector, mandated COVID-19 vaccines for the entire workforce, among other protections that have been put into place. Our objective today is to assess how we can successfully implement these policies for the city's workforce citywide. We must ask critical questions to evaluate lessons learned over the past 2 years of the pandemic. Has the city developed centralized systems to communicate important updates to staff and to the public? Is the city working collaboratively with our partners in labor to update their policies? Are the city's workforce protections being properly enforced? And is it enough? What are the plans for the workforce development, especially for those groups who have been working from home? What is the game plan for returning in person? This discussion will be ongoing. I look forward to the reports from the Workplace Health and Safety Board established by our Civil Service and Labor Committee, legislation Local Law 22. The board will make recommendations on protocols for future public health emergencies based on testimony from employees, employers, and the public, and other relevant experts. Today, we're here to get an update from DCAS, DCWP, DOHMH, and OLR on how to best support the workforce as we continue to battle the challenges posed by an ongoing pandemic today. And today's hearing also gives a platform for workers and those who represent them to share their questions and concerns. I would like to thank my staff who have worked hard on putting this together. Senior Advisor Joe Goldblum, Chief of Staff Ali Rasulunajad, Legislative Director John Wani. I'd also like to thank Committee Counsel Bianca Vitale, Policy Analyst Elizabeth Art, and Finance Analyst Nevin Singh for putting this together. Look forward to today's testimony and public discourse, because public discourse creates public policy. With that, we will hear from the administration, and council will administer the oath. Thank you.
Thank you, Chair. Can you all raise your right hands for me? Thank you. Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee, and to respond honestly to council member questions? You just say, I do. Thank you so much. Deputy Commissioner Dannenberg, you may begin when ready.
Thank you. Good morning, Chair Miller, and hopefully soon to be members of the Civil Service and Labor Committee. I'm Barbara Dannenberg, Deputy Commissioner of Human Capital at the Department of Citywide Administrative Services, also known as DCAS. Today, I'm joined by representatives from the Office of Labor Relations, DCWP, and the Department of Health and Mental Hygiene, partner agencies that have been critical partners to DCAS throughout the pandemic in helping shape the city's workforce policies. Throughout the pandemic, we've been diligent in providing expert guidance on safety protocols in the workplace based on the expert advice of our city's doctors and in alignment with city and state regulations. During the lockdown, the city quickly operationalized a teleworking system, and in the return to office, the city took the necessary steps to keep our employees safe. A vaccine and mask mandate, widely available personal protective equipment, or PPE, and optimized ventilation, among other safety measures. Throughout, city employees kept our city running, and their work has been invaluable to keeping us safe and healthy and in driving our recovery. This administration has been working daily to ensure that workers and workplaces are safe. This has been achieved through close attention to city and state regulations, Centers for Disease Control and Prevention, or CDC, guidance, and in consultation with the city's medical experts at the Department of Health. The city's protected its workforce using the same core principles health experts have recommended since the early days of the pandemic: masking, improved ventilation, hand washing, keeping distance where possible, staying home if sick, and testing. But we now have the most powerful tool of all: vaccination. And as our health experts and others worldwide have advised, vaccines, particularly when combined with these other precautions, prevent transmission and severe illness and save lives. This summer, the mayor announced the vaccination requirements for city healthcare and public health workers, and from there, we climbed the ladder, as he says. We now have a vaccine mandate for all city employees, and as the mayor announced just last week, the city is implementing a private sector vaccine mandate as well. In addition to getting vaccinated themselves, our workforce across multiple agencies has been vital to helping New Yorkers get vaccinated as well. Nearly 6 million New Yorkers are fully vaccinated today, or about 70%, which further helps protect our workforce when they are at work, in the community, in the grocery store, or at home with their families. In February 2020, DCAS issued a leave guidance for the pandemic. It has seen 10 iterations to stay up to date on the latest developments around COVID-19. We believe giving employees excused leave to recover from COVID-19 in quarantine, to be vaccinated, to take their children to get vaccinated, to take care of a loved one in quarantine or isolation, or to support a child due to school closure, has provided flexibility and created a workplace that allows employees to care for themselves and their loved ones while stopping the spread of COVID-19. In April 2020, DCAS issued a directive requiring employees to wear a face mask when interacting with the public and other employees. DCAS Commissioner's Directive 2020-1 now requires that every city employee able to medically tolerate a face mask must properly wear a face mask while they remain in a shared indoor city workspace. A shared workspace is a communal or open office setting where individuals cannot be separated by a closed door. The only exception is when someone is actively eating or drinking or has been granted a reasonable accommodation. As you may recall, on June 19th, 2020, DCAS, with support from OLR, HMH, and the Law Department, issued formal guidance and protocols to all city agencies on managing the office in the age of COVID-19. The administration continues to update this guidance, the most recent version having been released on October 21st, 2021. The administration's approach focuses on core categories: preparing the buildings, preparing the workspaces, preparing the workforce, and maintaining clear and consistent communication. In addition to the development of policies and procedures geared toward creating a safe and healthy workplace, this administration has also made available necessary personal protective equipment. This includes the distribution of more than 4 million bottles of hand sanitizer, 340 million face coverings, and over 300,000 items of cleaning supplies since March of 2020. This administration, like many state and local governments, has done an effective job of utilizing vaccine and face covering mandates as tools to ensure continued workplace safety. The DOHMH Commissioner's Order requires COVID-19 vaccination for incumbent city employees and certain city contractors. The New York City vaccine mandate requires that all other city employees must provide verification that they are vaccinated against COVID-19. This mandate continues to remain in effect. Further, since August 2nd, 2021, the city's required by Executive Orders 75 and 76 that all new hires provide proof of vaccination before beginning their employment. Since early 2021, the city has maintained a supportive environment for its employees to be vaccinated. Vaccination sites are accessible and appointments are easily scheduled. Employees are entitled to take up to 4 hours of paid time off to be vaccinated and to accompany dependent children to get vaccinated. This excused leave time is also available for booster shots. In addition, employees who are fully vaccinated are eligible for 3 hours of compensatory time off. If a covered employee has a medical condition or a religious belief that prevents them from complying with the vaccine mandate, they can and should speak to their agency's EEO officer regarding a potential reasonable accommodation, which are evaluated on a case-by-case basis. An employee may appeal a denial via the citywide panel or in some cases through arbitration. Those city employees who have not requested a reasonable accommodation and are in violation of the order have been placed on leave without pay until they either comply or separate from city service. Based on collective bargaining agreements reached with 27 unions, most city employees may elect to resign or retire and receive an enhanced payout of their sick leave days or extend the length of the unpaid leave. As of today, the percent of vaccinated city employees is 94%. Each agency tracks compliance for their covered employees. Employee vaccination information is considered confidential medical information under the Americans with Disabilities Act, or ADA, and is also a type of identifying information protected under the city's privacy law. This information is kept private and secure and is only shared with designated agency staff and city officials. To ensure that the city policies are well understood and implemented by agencies, DCAS holds regular meetings with the agency personnel officers, or APOs, on a weekly basis. During these meetings, our colleagues from OLR, FISA OPA, the Law Department, and City Hall are active participants and provide guidance in their respective areas of expertise. These forums provide a venue for agencies to gain additional insight and guidance on the latest policy updates, ask questions, and share information. DCAS has also held quarterly meetings with the EEO officers of city agencies and provided critical training on issues related to the vaccine mandate, such as reasonable accommodations. As always, I would like to thank Chair Miller, members of this committee, and your colleagues for your continued support. I look forward to discussing these policies to keep our communities and city employees safe. Thank you, and I welcome your questions.
So I suspect no one else will be testifying. So I'm going to kind of, we've been joined by Councilmember Rosenthal. Thank you, Councilmember Rosenthal, for attending today's hearing. And certainly she will join in on the questioning. I'm going to work backwards a little bit, and I'd like to, before we talked about the mandates and where we are on the compliance, whether it be the city or private sector workforce and enforcement on that, I want to kind of go back and talk about some of the things that we talked about in January, which was whether or not we had begun to adapt best practices, what those best practices were, how were we receiving information from government bodies, to the CDCs and otherwise, and how were we getting that information out to the relevant workforce, and whether or not the agencies involved, the specific agencies involved were getting that information out to the relevant workforce, and not only getting the information out, but giving the workforce the tools and resources to operate and serve safely, effectively, and efficiently. There was a lot of confusion because everything was ongoing and continued to be ongoing last January, as it was when we did our first hearing around COVID-19 and workplace safety. Specifically, there were new tasks taken upon and required by the workforce, and I'm not sure whether or not they were given specific training in order to meet those obligations. And so we want to make sure that we have evolved in that and what we have done to ensure that whatever real-time information, and it was the simplest things about usage of PPEs, it was social distancing, it was just the ongoing, ever-evolving information. How do we get that information out in real time? I recall testimony from one of the agencies that are here today, basically saying that, that the city managed too many different agencies, such a diverse workforce, and it was difficult to get that information out in real time. Conversely, I think DCAS did a good job on putting together regulations and guidelines around workplace safety and disseminating that. So what we'd like to talk about is how they were received and how they were enforced. So with that being said, I would begin by saying that the administration directed all city public employees to return to in-person or office-based work beginning September 13, 21. Since city public employees have returned into in-person work, what lessons have the administration learned about protecting health and safety of the workforce? What has DCAS learned from private sector, DCAS and DCWP learned from private sector policies and best practices about bringing employees back to work, back to in-person workplace? But before that, if you could expound on my little dissertation about where we were then and what we're doing differently now.
Certainly. Thank you, Chair Miller, and good morning. As you are aware, DCAS has, as you said, with the ever-evolving guidance, DCAS has updated the guidance almost 10 times. So as the health and safety of the city's workforce is our priority, DCAS has worked diligently along with our partner agencies in order to make sure this information is shared. DCAS shares this information with all city agencies through sharing the policies. We also have a web page, an APO portal, or Agency Personnel Officer portal, that is specifically dedicated to COVID-19 information, always with the latest information at the top and at the forefront so that people can easily distinguish between today's guidance and, say, January of 2020's guidance. Lessons that we have learned throughout this pandemic include first of all, that the city's workforce is highly skilled and highly adaptable, and that city employees very quickly pivoted to a telework environment from a workplace environment with almost no notice. So again, we would like to acknowledge and thank those city employees for keeping the city running during those tumultuous times. We've also learned that it's very important to have mandates in place in order to keep the workplace safe, such as a mask and vaccine mandate, offering paid time off and excused leave when employees are feeling ill or when they do have a positive case of COVID-19. And we have all learned from each other. As this pandemic has evolved, both the private sector and the city have worked very diligently, hand in hand in some cases, in order to stay abreast of the most recent guidance from the CDC and from city and state authorities.
And
Sorry, Steve.
okay, so I think one of the most pertinent questions is where we were then, and I would say not. I don't want to put this on DCAS because I know this was a question in some of our early weekly, bi-weekly meetings that we were doing with OLR, Office of Labor Relations, about some of the ongoing and ever-changing directives that was coming from the healthcare governing agencies, mostly from the federal government, state, and so forth. How were they being implemented? And quite frankly, the fact that we were told that not that it was difficult, but it was nearly impossible considering the amount of agencies, the diversity of the workforce, and how things changed every day and whether or not they were applicable to everyone. And so our response was who was responsible for that particular task. And so I'm interested to know if, in fact, those things are changing, how they're changing, how they've changed, what we have done differently to ensure that whatever guidelines come out based on new variants or new information, are we doing a better job in getting it out real time, specifically to those who may be a little more impacted than others?
Sure. Thank you, Chair Miller. So yes, as you've explained, the city's guidance has been evolving and changing, and there have been many iterations of the guidance shared. As I said earlier, DCAS shares this information with city agencies with the intention of city agencies sharing with their own employees. Each city agency is better suited in knowing how to get information to their employees, more so than DCAS would be. But as an example, DCAS shared information with employees regarding the new mandates and the changing mandates via commissioners' directives and commissioners' communications directly from the commissioner's office. They were also shared by the Human Resources Department so that so employees would have a contact person to call and to ask if they have a question. DCAS also held several town halls for questions and answers with DCAS employees so that employees were able to ask those questions in real time and receive an answer in real time from trusted agency supervisors. Another way that DCAS communicated with its own employees is through creating a web page specifically for the COVID-19 guidance, and we also included a frequently asked questions document that's available to all city agencies as well for employees to take a look, and if they have a question, to look in that document very quickly if they needed a quicker answer than reaching out and asking.
And so how does the administration ensure enforcement of these policies and that, not just enforcement of the policies, but to ensure that the information gets out real time and that there is compliance of these practices across all of the city's various agencies and workforce?
So city agencies are individually responsible for getting that information to their employees and for ensuring compliance of their employees. Because again, city agencies are best suited to know where their employees are and to better explain the compliance issues with their workforce in a specific way. So that is handled at the agency level and not via DCAS.
So if there were specific complaints lodged against agencies, compliance, lack thereof, where's that monitored? Where would that go? Is there a central database that the admin has? Would that be, where's that enforcement line?
So if there, thank you, Chair Miller. So if there are issues of compliance or questions about compliance, individual employees can always reach out to their human resources officers to ask about compliance and to ensure that their fellow employees are complying. If there is an issue with a particular agency or there are many complaints, the Mayor's Restart Task Force is also responsible for ensuring that agencies are compliant with all of these mandates.
What is the task force? Who makes up the task force, and could you tell us something about that? Them?
Certainly. As I understand it, the Mayor's Restart Task Force is made up of employees or officials from each deputy mayor's team. And so this team or a task force are responsible for the compliance of agencies.
So those would be the deputy mayors that have particular agencies in their portfolio, that they're basically somehow being bumped up to them? And is there a central database that we know that ultimately is going to be bumped up to someone who's responsible for enforcement, such as a deputy mayor? Or this particular collaboration of individuals that make up the task force? Is that it? And if that's so, what concerns have we received over the past year and a half, and how were those concerns dealt with?
So regarding the Mayoral Restart Task Force, I'm not aware, as DCAS does not have a seat on this task force, I'm not aware of how they track information or whether it is centrally located. However, I can find out and provide you with a representative from the task force to answer that question. Regarding employees and employees having access to file complaints and to know who to speak to, I did forget to mention that employees do have the opportunity to reach out to their labor representatives as well in this instance. And I would like to kick it over to my colleague Steve Banks for further information.
Yeah, and I will say that while it's not the sole mechanism for employees or individual issues to be raised, certainly our office, as being the main liaison with the labor unions, since March of 2020, we've dealt with various issues. Obviously, there's been a lot of changes in what the focus has been. As Barbara said, initially it was everybody adjusting to being at home. Last summer it was more about, the summer of 2020, it was more about being ambassadors for social distancing in the parks and outside and stuff like that. And now most recently, in the past couple of months, we've been dealing with the vaccine mandates, but we're dealing every single day with labor representatives, and there have occasionally been issues. It usually hasn't risen to the level of a grievance or any kind of litigation. It's been more of a labor management conversation where we might be alerted that a given agency is, or really not necessarily an agency, but a work location. It's usually more of a remote kind of work location, might be out of step with what the general practices are, right. And we're usually able to resolve that with the agency.
So that would be my concern about some of the concerns that the workforce actually has. Obviously, there's a process, and we talked about the grievance process in terms of those terms and conditions and what workplace safety looks like. One, have you received such grievances, and what are the grievances that, and are they based on kind of each step that you articulated of where we were from the very beginning, and the PPEs and the social distancing and other areas to workforce mandates, are they based simply upon that, or is it something specifically that we're seeing around compliance? That is there anything that we were seeing in 2020 that we're still seeing today that concerns the workforce, considering all of the safety mechanisms that have been put in place subsequently? Are there things that are still occurring? How do we address those? And then we could talk about where we are today in terms of mandates.
Yeah, so one of the things that we're most proud of at OLR is that we have good everyday working relationships with all of our labor partners. So the instances of something rising to the level to be a grievance or litigation, I'm general counsel at OLR, so I see the arbitration cases and the improper practice cases. I can really count on one hand the number of cases that have been filed, related to these COVID-19 protocols since the pandemic started. And I can think of, at least a few of those have been settled between us and the union, in the course of those cases. But it's obviously a continuing effort, right? We've also had some discussions recently with District Council 37 and the MLC about setting up a standing labor management committee that would be something a little bit more formal, right? What I'm describing as it's occurred has been a little bit more informal. A union will give us a call and say, do you know what is happening at such and such an agency? And we try to work through those issues together. We've talked about setting something up a little bit more formal, where there might be a monthly or quarterly labor management meeting with representatives from Barbara's office and OLR and City Hall and a wide swath of unions, so that everyone's hearing the same message. So we'll probably get that set up and going when we're in more of a steady state.
So you said there was a probably just a handful of grievances around this issue. Is that because that they were resolved, or there were just no concerns that we kind of, before we went through the formal grievance process, that it was a phone call and kind of subsequent conversation that things were able to be worked out? And if that were the case, how many, specifically what grievances found their way through the process, going through the process?
Yeah, so from my standpoint, I think it is what you mentioned, that issues, first of all, not every single issue is going to go to the citywide Office of Labor Relations, right? The agencies and the labor unions, if an issue arises, are able to work stuff out too. And so, yeah, that's my sense, is that when questions have arisen, we've been able to resolve those sort of before they become a grievance. That's my perception.
Okay, we've been joined by Councilmember Denowitz. Thank you, sir, for joining us. This is, I assure you, Councilmember Denowitz, as a former New York City public school teacher, is very much concerned about workplace safety within the DOE and just, again, how services get delivered and how we protect our workforce and those that they are charged with servicing. Are there, in relationship to those grievances, are there some agencies that are more aggressive that in terms of grievances, which means that ultimately they could not resolve some of the concerns that represented the needs of the workforce?
No, I don't think so. I think that our city agencies, by and large, are all on the same page in terms of the protocols. Like I said, the issues, again, this is just my perception from what I've seen, have been more at, like I said, some of those more remote work sites where there might be only a few number of employees, right? If you have the buildings where a lot of city employees are, the Muni Building, One Police Plaza, right, places like that, I don't think you're going to see health and safety complaints or issues, but there might be individual isolated circumstances where there's a garage in some part of the city and, they're not following the protocols as they should. But then once I think you get in touch with agency leadership, those issues, as I've seen them, have worked themselves.
So you know what, I'm going to just jump because I'm reminded of a particular agency and clearly, as we move forward, we know that there are some agencies that have vehemently disagreed with the mandate, and there have been grievances filed, whatever, and we'll kind of get into that. But what I know is back in 21, January, February, that there were a couple of breakouts, and in fact, during the hearing, we highlighted some of the problems that were going on at places like the Board of Elections, in which there had been multiple breakouts at different facilities during the course of the pandemic, that there had been several lives lost, and that, quite frankly, there had been a level of negligence, and that was highlighted. Specifically, that you had multiple agencies sharing the same brick and mortars, and during outbreaks, they were managed in different ways by different agencies. And that obviously spoke to a lack of coordination, but it also spoke to a lack of oversight, whereas someone can come in and do immediate testing, do an immediate cleanup, and mandate quarantining and or shutdown, where others were allowed to just go on business as usual. How do we address something like that, and what are the possibilities that we will see something, such a situation in the future where multiple agencies being housed in the same location will be responding so vehemently different?
Thank you, Chair Miller. As we discussed earlier, DCAS released guidance managing the office in the age of COVID-19. This guidance has also been updated quite regularly, and within that guidance, there are protocols for when there is a positive case, both in the workplace and outside of the workplace, protocols for cleaning and deep cleaning, and also who to contact if you have questions regarding these processes and policies. I'm going to turn it over to my colleague at the Department of Health for further information.
Thank you, and thank you, Chair Miller. Yes, so as is outlined in the DCAS guidance about managing cases in the workplace, when a city worker tests positive for COVID-19, they need to tell their HR person, and then we have a process set up for agencies to handle those cases and to report them. There's a phone number that they can call at the health department to report cases and close contacts, and to get guidance on how to manage contact tracing for people who may have been in close contact with the individual at work and might need to be recommended to quarantine. So just a reminder, as we're talking about contact tracing and identifying who are close contacts, those are a person who has been for at least 10 minutes within 6 feet of a person while they were infectious with COVID, even if they were masked and vaccinated. That's identified as a close contact, but people don't need to quarantine if they have been vaccinated, even if they had a close contact. So these are all the guidance that is in the DCAS guidance and that we're helping to implement across the city.
Well, clearly, the incidents that we're referring to preceded vaccine, right? So we're talking January, February, and maybe the very beginning of the vaccine, and not necessarily a viable option, but in terms of those folks that may or may not have been in compliance back then. So let me ask you this. Do we know what the vaccine percentage is for individual agencies? Do we have that information available?
I'm going to have to ask my colleague at Department of Health to provide that information.
So I don't have the number of cases among city employees with me today. We can bring that back to the health department and see what we might be able to provide. I will say we are monitoring those cases for any patterns that might indicate that transmission is occurring in the workplaces, and that we are not seeing patterns that indicate that transmission is happening within the workplace. And I think that speaks to how effective some of the recommendations have been around how to manage the workplace during COVID.
So in the case that we saw last year where we had infections at these facilities, these DOB facilities, and you had DCAS employees and taking part, working in the facilities, you had DO-IT employees, and you had the Board of Election. employees and being managed so differently. And I think what we've seen over the past year and a half is the different impacts COVID-19 have had on different communities, as highlighted on gender, race, ethnicity, and so forth. Want to make sure that that is not manifested itself even within the New York City's workforce. And so when we look at those who are, love to see those who are vaccinated within those agencies to kind of speak to it. And if as we move forward, what is being done to encourage folks? Obviously, people have very strong feelings about to vax or to not vax, but these agencies that I'm looking at that are, so you don't have any numbers here? What are the numbers for the police department? Does anybody know? Fire department, Department of Corrections, FDNY, Board of Elections.
As my colleague stated earlier, we don't have those numbers for individual agencies, but we could certainly see what we have available and provide that to you in your office.
Have any of these agencies filed a grievance on the vaccine mandate? Any of the bargaining units representing workers for these agencies?
So yeah, we have had a couple of improper practice cases filed regarding the vaccine mandate that are currently in litigation. From a handful of unions. And I think you rightly made the distinction between the agencies and the unions, right? Our agencies have been fully supportive and have been rolling out the vaccine mandate, and that's why we're at 94%, like my colleague said. We have had some isolated instances where we've had some challenges from unions, which my office is responsible for defending, and that's currently, those are pending.
So how many specifically grievances are out there from how many agencies? Do you know?
I think related to the vaccine mandate, there are 2 cases.
Two ongoing or 2 grievances that have been filed?
Yeah, so I'm not aware, a grievance is an allegation that the contract was filed. I'm not aware of any grievances that are pending at my office. We do have a couple of improper practice charges. I think 2 are currently pending. And there may have been a 3rd that was filed and withdrawn.
And what do you know what agencies they are, or what bargaining units that filed those grievances?
So one was related to the fire department, the UFA and UFOA, and the other was a group of unions that are employed at various agencies.
Okay. So, DCAS issued 8 revised workplace guidelines between June 20th and October 21st. The municipal workforce returned to workplace in September of this year. Of those, what is the impetus for each date of health and safety guidelines? And did OLR give input on each update and health and safety guideline? As well as OLR, how much, for DCAS perspective, and I know early on, but how much of policy, of this policy reflects the collaboration between labor and agency partners? Or is this just a straight DCAS thing?
Thank you, Chair Miller. The impetus behind all of the updates to the DCAS guidance were due to either CDC change in mandates, state or local authority change in mandates, and all of these updates were made in collaboration with our oversight partners, such as OLR, Department of Health, the Law Department, and City Hall.
And in terms of the local bargaining units representing workers, what did their involvement look like in this process? Because I've spoken to some of my contemporaries who contend that they didn't have much involvement in the process, and that concerned them.
Sure. So, I mean, with regard to the DCAS policies that Barbara was describing, we certainly disseminate those to all of our labor unions. I know you mentioned earlier some of the challenges with getting communications out to all employees. I think to add to everything that Barbara mentioned earlier, that our labor partners are another important way that information gets out there. So anytime any of these major policies have been changed, usually a day or two before, we share them with each union. I think we have a sort of a mailing list of 47 different organizations that these sorts of communications would go to. And while a lot of this has been changing very quickly, like Barbara said, you know, if CDC guidance needs to be aligned to, it can't wait for, you know, a whole round of comments. But there have been instances where we get feedback from our labor partners as part of that process. And if we're not able to make an amendment, an appropriate amendment to that version that's going to go out a day or two later, then it might be incorporated into the next one. And usually, like Barbara said, with OLR reviewing as part of that drafting process, obviously our role and responsibility is we have an eye to what the reaction of our labor unions would be. So, you know, through us, that's another way that you know, is sort of anticipated even before it's a comment or a suggestion.
Each agency is required to establish a joint labor labor management, workplace safety committee to raise health and safety concerns and review implement policies. Can you give an example of some of the tangible policy changes resulting from these committees? Or do you hear from, and so let's bump that up. So we're talking about agencies. Do you guys actually hear from these committees within the agencies? Is there a role for them to play in implementation of policy, considering what's happening on the ground in terms of what you guys are receiving, maybe CDC, as it relates to a particular workforce? What's the collaboration around implementation of that?
Yeah, so those joint labor management, health and safety committees that you described, you know, they would occur at the agency level. Usually, my understanding is that it would be chaired by like the director of labor relations at each agency. And the purpose of those is, you know, well before COVID, to have regular systematic meetings and to have a forum for issues to be raised and resolved. And obviously, the content of those meetings is going to be very different depending on which agency it is, and what health and safety issues might arise at the fire department as compared to the Department of Correction, and stuff like that. So, you know, we don't get, as an oversight agency, we don't get regular reporting on those meetings, because I think the very purpose and the very idea is that it's supposed to be for hyper-localized issues, right? It's not a citywide policy. It's not a DCAS policy that applies to every agency. It's going to be very specific to whatever that work site might be and whatever issues labor and management might need to work through together.
Right, and so my concern is that those concerns of those very nuanced concerns of individual agencies that are brought forth by those working committees around health and safety, I think those are probably the most significant in terms of creating policy impactful policy. How do we ensure that their voice is being heard and that there is compliance?
Thank you, Chairman.
Or is the responsibility simply just these are the guidelines, you guys work it out? How does that work?
Thank you, Chair Miller. One of the ways that these labor committees, again, as my colleague explained, they are focusing on localized issues within an agency. However, if an agency does have questions about that localized issue, or if they express concerns about those localized issues, I want to reiterate that DCAS hosts weekly information sessions with the agency HR community, and we also host regular sessions with the EEO community. But this is a forum for people to attend in order to raise these issues and seek clarity or seek further guidance on specific issues that are happening at their agency level.
Right.
And these meetings are actually quite popular. Some weeks we'll have 300 representatives who are clearly not specifically HR representatives, but they do include other folks from the agency who do have questions that must be addressed.
And so has that dialogue shaped policy, helped to shape policy as well? That voice, that sort of not normally HR or policy voice, has it assisted in that very hyper nuanced way of keeping people safe? So the point is, how are we creating and replicating this opportunity for workers throughout agencies, and what does the oversight of that look like? I have some very specific concerns about agencies that we know weren't doing well. We know that when we looked at the demographics and the numbers of who the frontline workers are, the communities that were being impacted, and that these are generally marginalized communities of color, that folks that are forced to go to work every day, that don't have an opportunity to work from home, potentially infecting themselves, their family, ultimately their communities. Have we paid particular attention to that? Have we paid particular attention to the EMS workforce that is predominantly black and brown, that is predominantly women, that obviously were the frontline, particularly considering that in the first week of the shutdown, FDNY put out a memorandum that said that they did not answer COVID-related calls nor respiratory-related calls there because of they lived within congregate living settings and potential for the spread, and therefore this task was laid solely upon EMS. And we know they had a significant number of early challenges, high number of infection and deaths. And we also know that they represent marginalized communities. What specific attention have we paid to that, if any?
Thank you, Chair Miller. Regarding, just to go back to the beginning of your question, regarding individual voices and individual situations at agencies, I had mentioned that we do discuss them at our weekly forums, but I neglected to also discuss what happens after those weekly forums. And again, the oversight agencies meet regularly to discuss such issues, especially when we don't have a good answer as to how to handle that. So yes, individual concerns and individual issues at agencies or within workspaces do rise to the level of assisting us with making either our guidance more clear or offering more flexibility with certain guidance or offering more examples of how to implement the guidance. Regarding the particularly minority population and vaccination, again, I would just like to reiterate that we are extremely grateful to our essential workers for showing up and working every day and keeping this city safe, and we are deeply saddened by the loss that resulted from that work. There is a racial equity vaccine committee that does address these specific issues with specific jobs, agencies, and then also neighborhoods where we are seeing vaccination rates that could be improved and are falling behind vaccination rates of other work populations or other neighborhoods. And I'd like to ask my colleague to offer any further information regarding those vaccinations and what we're doing to address.
Thank you. Yes, I think Barbara summarized this in her testimony also, that as we've rolled out our vaccine program, the issue of racial equity is something we've paid very close attention to, both at the health department and in the vaccine command center. And we've really seen a lot of effectiveness with the vaccine mandates that have been put into place and climbing the ladder, so to speak, of extending those vaccine mandates to cover more of the population. But in addition to that, the health department does a lot of community outreach through a lot of neighborhoods, and we've also, again, partnered with our fellow city agencies to make sure that people have the information that they need to make a decision about vaccination.
So are we working with those specific bargaining units representing those women and men of these agencies that are being impacted? Specifically, what resources, what are we doing to impact, number one, those with higher infection rates and those with low vaccination rates? Have we identified them, and what are we doing to work with those groups? And then again, what are we hearing from those groups about their concerns, and if they have any complaints about either or, to whether it's, because we are folks in, I do believe in the mandate for the municipal workforce, but at the same time, people have legitimate concerns. What are we doing to mitigate those concerns and create outside of the vaccine, or is the vaccine the end all, and that we no longer focus on all of the other things that have gotten us here, as you said, and the thing that we continue to make sure that we're sanitized, clean, social distance, and do all the things that need to get done, but also doing all the things to protect the workforce, right? Which means those who have to see clients, very early on, I remember in my industry that, the MTA said don't wear masks because they offend people. They offend customers, and they're not going to ride, and other things like that. And I know that there were agencies within social services that continue to see clients, and clients were not mandated to wear masks, although you were. And then at the same time, we weren't sure on what social distancing meant, and it meant something different depending on the services that were being delivered. What do we know about that, and what's the feedback, again, from the workforce, and how do we address that?
Thank you, Chair Miller. As I had discussed earlier in my testimony, DCAS and the rest of the city feels that clear and consistent messaging regarding mandates and how to create a safe workplace are critical in keeping our city workforce safe. You are correct that, at certain times we had different, masking mandates or no masking mandates, testing mandates throughout the course of the pandemic. So as the guidance and the science has evolved, so has our guidance. And, so today we can say that we recommend that all employees be masked at all times, especially when they're interacting with others, when they're not eating and drinking. So this mask mandate has evolved, as you said, throughout this process.
And certainly, we know that the vax mandate is applicable to everybody, as you said, except for those who have some reason for reasonable accommodations, and others. I know that, prior there were agencies that were allowed to test out, and what was that? Was there a success in that, or that forced us to move away, the lack of success, or we were looking for uniformity within the mandate? What did the numbers tell us, and why did we move so aggressively toward the mandate as opposed to a testing option?
I'm going to ask my colleague from the Department of Health to talk about the importance of the vaccine mandate.
Thank you. Yes, vaccination is definitely our strongest and best protection against both transmission of COVID-19 and also of the most severe consequences. So although testing can help to identify cases, it will not identify all cases, and it can't help people protect themselves from the most severe outcomes of COVID-19 infection.
I thank you. And then, and while we're on that, and I wasn't quite ready to transcend right over to the vaccine, but we talk about boosters and what the future may hold.
Sure. So people now 16 and older are eligible to receive a booster, depending on how long it's been since they finished their initial course of the vaccine. The health department is strongly recommending that everyone who's eligible for a booster get a booster. That will be our best protection going into this winter, and we are seeing cases rise over the past month or so already.
Okay. And before we kind of just finish on that, on the vaccine, could we talk a little about the private sector workforce and DCWP and the work that they've done and what we see with the paid sick and other things and implementation before we get to the implementation of the mandate, but what have we seen? And I know it was a little bit of a more challenging task to kind of to reel in a far larger workforce, but also one that, you know, not sure what authority and that we actually have to implement some of these policies. But what have we done? And particularly as it relates to the HEROES Act and the law that mandate extensive placement of healthcare safety protections in response to COVID-19, the purpose as relates to these frontline workers, to the disease, and what has been the response thus far?
Thank you, Chair Miller. I want to be very clear. The paid safe and sick leave law has saved lives. The City Council has been ahead of the curve. That law has been amended and expanded since 2014, most recently to allow for additional time, 4 hours per shot per child or dependent. And these are the exact laws and regulations that are helping our city's recovery today. So paid safe and sick leave has been successful, and we're honored and quite frankly determined to continue to enforce that law, especially during these times. As it relates to the HEROES Act, that's a law that the Department of Labor as well as the Department of Health of New York State are involved in issuing guidance as well as enforcing. Of course, DCWP's Office of Labor Policy and Standards is a hub to all workers, regardless of jurisdiction. Workers have a number of different ways to reach our office by phone, email, and otherwise. And we make referrals as necessary and provide that top-level guidance. You know, during the pandemic, right from the jump, we established a homepage on our website, nyc.gov/DCWP alerts. That was a centralized hub where you could find guidance, for example, for workers and employers in a range of different languages, often above and beyond what's required by local law, that had all the different requirements, New York State, federal, as well as municipal guidance, so that employers and workers knew what their rights were, or employers what their obligations were. You know, in 2014, our first campaign for paid sick leave then, before we incorporated safe leave into this, was that if you feel 100%, you'll work 100%. And we believe strongly when we issue these guidances, when we're out doing outreach, business to business, hosting webinars, utilizing our faith and community-based partners, that we are moving the needle in New York City's recovery. And we're, like I said, we're committed to that work and honored to do it.
So, in terms of enforcement, how is it done? Do we actually get out to make sure or that all these regulations, all this new policy is being adhered to? Are we looking to see that this crucial information is properly posted throughout the city of New York? What does that look like in terms of, do you have the support, the workforce that allows you to support workers in that way to ensure that listen, ignorance is bliss, and there are a lot of folks, particularly this very vulnerable workforce, who aren't organized, doesn't have this information readily available to them as a target audience, right? So every worker in the city of New York is not being contacted by their union by updated policy and other things. How do we reach our target audience in this case, and how do we ensure that the proper enforcement happens when people aren't in compliance?
Thank you for the question. Well, you raised two great points. I think first and foremost, what we always say, the greatest way to get ahead of this stuff is by affirmative outreach. At DCWP, we leverage our in-house expertise to make sure that we're reaching out to targeted audiences based on a data-based approach and strategically. During the pandemic itself, we leveraged not only our own in-house expertise, but also information that Test and Trace, for example, had, joining them on door-knocking campaigns, being present at dispensary sites for the vaccines, so that folks knew what resources were available, so that if there was ever an issue for them in their private, workforce job, that they knew that the city government had rights that were or regulations that applied to them. As it relates to our enforcement, in general, as with all our municipal workplace laws, we enforce by receiving a complaint or by launching a proactive investigation in an industry. Right now, for paid safe and sick leave, we have a campaign that's underway, and we have adapted that campaign not only to incorporate the most recent change, which is that 4-hour additional time per dose per child or dependent, but also, importantly, we're learning from our enforcement. We know that there are certain industries, for example, through our investigations, that have had issues with paid safe and sick leave compliance, and we're working with our vendors to ensure that we're doing direct outreach and enforcement to those industries so that they know about the laws and are up to date with the latest guidance.
Could you give us an example of some of those vulnerable industries or industries that have been least likely to be in compliance for whatever reason?
Sure. I think that we most recently had an announcement about a joint investigation and settlement that we had with the Attorney General's office related to home health care industries. Our paid care division at OLPS is dedicated to reaching out to this vulnerable constituency and making sure that they're aware of the laws, and they will be, as I alluded to earlier, subjected to direct communications, of course, in multi-languages, as well as the employers themselves being put on notice about the different laws and the adaptations of it and as it relates to them.
Could you speak about the information obtained from Test and Trace, and there were some questions about their effectiveness, but particularly as it relates to workforce, data received. Could you give us some insight on that?
Sure. So I do want to be clear, when we deploy our outreach throughout the city. It is most often database and also based on requests that we receive as an agency. You know, in the case of test and trace and others, a lot of that work and where boots were on the ground were indicative of places where there were you know, low utilization of vaccines or high rates of spread. There was also, just on our own and just pivoting a little bit to how we leveraged our Office of Financial Empowerment, which is also at DCWP, we relied a lot on demographic and census data where we saw, where we know there are communities of low-income neighborhoods that utilize a number of different government resources, and we wanted to make sure that we're using that information and applying it to, of course, getting the word out for this life-saving law, the paid safe and sick leave law.
Yep. So specifically on that note, as having identified those communities and those workforce within those communities, how then, given the potential lack of access, online access, how do we reach our target audience? What did that look like?
Yeah, I mean, I think it's ever adapting. Obviously, during the pandemic, we did a lot of work over webinars, but also importantly, understanding that many of these folks may not have access to certain technologies where they can you know, hear this information firsthand. We had boots on the ground. We went door to door, whether it was with test and trace or just on our own, helping out with the reopening for New York City. You know, that was more business facing, but also, you know, relying on community and faith-based leaders, those that have already great standing in these neighborhoods, and making sure that they are amplifying our work and adding another level of validity to what we're saying.
Okay. And for OLR, we know that you know, based on collective bargaining, there are very, very specific language around sick leave usage, right? Which I'm sure there's some, but very few have permit sick leave usage for dependent spouse and so forth. Have you addressed that? Have that been, what does that look like in terms of being able to actually use those end times that we're seeing now outside of the specific CBA?
Yeah, I appreciate that question. So the policies that Barbara described in her testimony and in response to some of the questions, particularly the excused absence if someone has symptoms of COVID or if they test positive, the time off and compensatory time if someone goes to get the vaccine, and then most recently the time off to take your child to get the vaccine. Those are all over and above the annual leave and sick leave benefits that are in our collective bargaining agreement. So they're you know, layered on top of whatever existing leaves and policies might you know, might have pre-existed. And that's one of the reasons why when I mentioned that we regularly communicate with our unions with some of these policy changes, the general response, and you know, I don't want to paraphrase, but it's been, thank you, we appreciate it, because
So they have been modified universally, and to what degree does agency have discretion as to whether or not they're going to comply? Is it about availability or something like that? You know, are we hearing that?
No, I mean,
complaints around that, or is it universal that you can now use sick leave for dependent children, spouse, and those living in the household, or whatever, however broadly defined?
So the DCAS policies that we're talking about, which relate to excused leave, right, leave to go get the vaccination or to bring a child to get the vaccination, those are applicable to every mayoral agency. I mean, it might get a little bit more nuanced with non-mayoral entities like the city council, right, where there might be a little bit of discretion there. I'll let Barbara speak more toward DCAS's jurisdiction, but for the folks who we deal with, right, the uniformed and civilian mayoral agencies.
Now, I'm talking specifically about sick leave, annual leaves.
Right, so what we're
Yeah.
providing for,
Specifically, sick leave is under city's collective bargaining agreement is for you, right?
So-
Not for your child, not for your spouse. Has that been modified?
okay, so yes, in general, if someone has a sick leave bank, if they accrue sick leave, like I accrue 12 days a year, you can use up to 3 for the care of a family member. That was pre-COVID. In addition, since the spring of 2020, and Barbara can fill you in on more of the specifics, we've been providing excused absence, so you don't even have to charge your sick leave balances for a variety of reasons.
Well, how do you get paid if you don't use your sick leave?
It's
is it-
excused
is it-
absence.
is it-
You're getting
is it-
paid. It's better. You're not charging your leave balances and you're getting paid.
So you have an excuse out in addition to annual and up to how much time?
Sure. If I can provide some further information regarding the excused leave. Excused leave was originally made available at the beginning of the pandemic through the FFCRA, and that is through the federal government. And again, these precautions were put in place so that we were not penalizing employees who may have used their sick leave balances or their annual leave balances, or who, those in the private sector that actually didn't accrue any.
So this is not FMLA, but it's some form of FMLA. But FMLA, you ultimately use your own entitlement balances if you want to get paid. So how does that work now?
This is separate and apart. You are correct that with FMLA, you would exhaust your leave balances. With excused leave, you do not have to do this. You don't have a bank. This is leave that is provided by the city on a case-by-case basis for individuals, as Steve reiterated, either who have COVID-19 themselves, have been exposed and are required to quarantine, their child's school has been closed, and so they need to stay home with their child. All of this excused leave is separate and apart from an employee's leave balances. Their leave balances are not touched. There's no need to exhaust them. And again, it was made possible through the FFCRA. That expired. The ACE, the American CARES Act, came out afterwards, but the city, and that also expired. However, the city continues to provide this excused leave, again, as a major line of defense in order to keep our employees safe and to keep the workplace safe. So
Is
if you feel
it
ill,
unlimited?
I'm sorry?
Is it unlimited during the course of the illness and recovery?
So if you contract COVID-19, you are the employee, you have up to 4 weeks of excused leave. However, if you are hospitalized due to COVID-19, as many people were at the beginning of the pandemic, the excused leave will cover you from that time that you are hospitalized through your recovery.
Is this a New York City policy? Is this a federal policy? Is this a state policy? And where's the money come for to pay for it?
This began as a federal policy, and the city has, as we do with most of our leave and most of our lines of defense against this disease, the city has expanded upon it and kept this policy in place. I can't speak, we don't have a representative here from
Because
Illinois, so I
I've
can't
heard
speak
from
to
workers
that.
that were hospitalized early for a significant or sick for a significant period of time. I know one person was for almost 40 days in March of 2020. The recovery lasted nearly a year. When they went back to work, all of their balances had been exhausted. So my question is, was it about, at that time, it was 4 weeks and did not run unlimited at that moment or whatever. So if we can get, I don't want to spend too much time on that, but that is certainly a question that we've heard in my office from multiple agencies, that they came back to work and they didn't have any sick days, didn't have any annual days. They were then, and these are folks who were sick, who took them 6 months after the so-called recovery or getting out of the hospital to get back to work. So, again, how we protect the workforce is important. So that's good to know. Does everyone know that? How does that work? And then for the health experts, how much of this is this policy and recommendations would be applicable to the city's workforce and on the private side as well? Obviously, MTA has a different policy, right? But clearly, you know, some would believe that it was a big, in the early pandemic, that a large chunk of the infection occurred probably underground and those kind of settings. And for them to have a different policy certainly potentially has an impact on the entire city's workforce and everybody who's using that system. Is there any public policy that it is not consistent, and or do you know that the new mandates, mask mandates, will make a difference as well? What are your thoughts on that?
Yes, thank you, Chair Miller. So the Health Department has guidance on our website for a variety of different kinds of settings, including the workplace settings and schools. Fundamentally, all of the guidance and recommendations that we have are based on what we know about how COVID-19 transmits and how to protect people. So it really comes down to some very basic principles. Stay home if you're sick, wash your hands frequently, wear a mask, especially indoors or if you're in a crowded setting, and when possible, physically distance or stay about 6 feet apart from other people. Now we also have vaccination, which is a huge, tremendous help in our ability to fight this disease. And then we also recommend frequent testing, especially if you've been in situations where you might have been exposed. So although we have a lot of really detailed guidance about, you know, different types of settings and how to apply it, and that's what all of the agencies have had to work through as they've applied the guidance that DCAS put forward, they're really based on the same basic principles that, you know, we've been learning about this disease over the past 2 years.
As we conclude, could we just briefly talk about the city's workforce mandate, some of the successes where there's still some meat left on the bone, the work that has to get done, or is there a particular concentration around a particular agency, industry, or demographic, and then ultimately, you know, can the administration share any additional information with the committee about the rollout of the private sector vaccine mandate?
Thank you, Chair Miller. And yes, we will find a contact person in order to provide that information regarding private industry to you. Regarding the city's vaccination rates, as I stated earlier, the city's city employee vaccination rate is about 94% as of today. Our return to office was in September of 2021, and we do consider it to be very successful, so much so that thankfully in part to the vaccine mandate and the mask mandates that were both put into effect. Regarding populations, I'll ask my colleague at the Department of Health to provide further clarification on different populations.
Thank you. Yes, so we now have 70% of all New York City residents having been fully vaccinated or completing their initial course. That's 89.8% of adults. We have a ways to go in the younger age groups that just became eligible to become vaccinated very recently. And then, like we spoke about a little bit earlier, we're also strongly recommending boosters for people who are eligible, depending on when they completed their initial course of the vaccine. Again, that's going to be very important heading into the winter months as we're seeing transmission increase.
Thank you. And Are, are we cognizant of those agencies, that workforce that are, again, I've asked it about 3 or 4 different times in different ways. Do we know, have we identified, and what does that ongoing dialogue look like? Because obviously now that we have the vaccine, it's 2 things. How do we keep people safe in whatever ways, right? Because whether it's the variances or the outliers, people continue to contract, whether they're boosted, whether they're have vaccinated or not, right? And so best practices continue to need to happen, and we need to, have the ongoing dialogue. But for those, and then, but now that we're at that point, what happens to those who are not in compliance? How many folks have been impacted, and where they come from? What happens? Are they placed on temporary leaves for X amount of time? And if you're not in compliance, do you then go from a temporary to a permanent? Are you forced to resign and retire? What does that look like? I know it was read in the statement, but it's so important. Can we drill down on that a little further?
Thank you, Chair Miller. Yes, as of November 1st, all city employees must be vaccinated. However, some employees may have requested a reasonable accommodation to the vaccination mandate, and if employees have not been vaccinated or have not pursued that reasonable accommodation request with their EEO officer, those employees, as of November 1, have been placed on leave without pay with health benefits. And I'll kick it over to my colleague at the Office of Labor Relations regarding the length of the leave.
So Barbara mentioned earlier that we were able to reach agreements on some of these procedures with 27 different unions, and those agreements provide for options for employees who've been placed on that leave without pay status to either separate from employment or to extend the length of leave. So whether it's an employee who hasn't chosen one of those options or isn't covered by one of those agreements, they're currently on that unpaid leave, currently.
Could you just, the last line?
Sure. If someone is either not covered by one of those agreements or hasn't chosen one of those options, they're currently on a leave without pay, as Barbara mentioned.
So how many is that? How many folks are there any ones that are kind of in limbo waiting for that status to be determined and evaluated, and while they wait to see if they qualify, are they allowed to continue to work? And if so, do we know how many people fall into that category?
So yeah, there's different categories of employees, and I wouldn't call someone in limbo if they've been on leave without pay since November 1st and didn't request any kind of accommodation, right? They're not getting a paycheck. They're on leave without pay.
So you just can't show up in that status?
Right.
Okay. There's no one who is waiting to see if they're going to receive the reasonable accommodation that is allowed to continue to go to work?
No, there are. My example was someone who hadn't even requested an accommodation. If someone has requested an accommodation and hasn't gotten a decision on that yet, they would continue to work, be tested weekly while that process is ongoing.
And what do those numbers look like?
How many people requested an accommodation?
And that remain working?
I'd have to go back and get.
Because there are some folks who requested and either they've been granted or denied, and so either they're not working or they're back to work. And then there's the other case, and is it that EOC and others that are responsible, who are tasked with figuring this thing out, do they not have the capacity, or they, why?
Yeah, I
Are
mean,
they backed up? Are the numbers that great?
yeah, I mean, I think it's a combination, right? Every agency has EEO offices that handle reasonable accommodation requests in the normal course, but the November 1st vaccination deadline obviously led to a deluge of reasonable accommodation requests. So it's about the agency getting through those, which at some of our larger agencies, like the police department, could be thousands, right? Getting through those, doing a case-by-case analysis and determination, and making their decision at that early stage, and then, you know, there's a whole appeal process after that.
And as you mentioned, of course, those who do find themselves awaiting a decision are allowed to work, and they are tested weekly.
That's correct, yeah, as long as they got their request in before the mandate went into effect.
Okay, and does OLR or any other agency, mayoral agency, have access to this data, or it is just?
I can
agency?
probably get information about how many reasonable accommodations were filed and how many have been decided. I think OLR doesn't track it, but I think it is tracked.
And the health department, what role do we play?
So the health department does track it for our own health department employees.
Or just for your employees? Could you speak to that? What is that? What do those numbers look like? I'm always baffled, and I'm particularly baffled that a lot of them come from communities of color. Some of the folks that are not, and I'm talking about neighbors and family and things like that, and having. Do you know what your numbers look like in terms of
I don't
what
have
is
that
the
data. We'd have to get
vaccination
back to
rate
you.
for health department?
Right, we'd have to get back to you on that.
It is who?
We would have to get back to you on that. I don't have that number in front of me.
You don't know what the health department number is? It is 50, 60, 70, 80, 90. We have no idea. Does anybody know? I mean, that's the outlier. Like, that's kind of the folks that we're getting our information on, and a lot of the optics of safety around vaccination and policy is, you know, from those people that are directly responsible for delivering those services has an impact. So I'd like to see what that is. Anything for the admin?
Did we leave anything else? Yeah. And I wrote down follow-up questions, so
Okay.
we can always ask follow-up.
Okay, we do have a few follow-ups, but we really, really appreciate your time. We've had obviously ongoing conversations over the last nearly 2 years now about this. There's been some really good work done in keeping our workforce safe, and there's still a lot of question marks out there as well, right? For me, tons. But that being said, considering the magnitude of the pandemic, where we were, where we are now, where we are, at least we have answers. If you do this, here's what where we should be. I am obviously worried about the surge that we're seeing now and the new regulations that have come down, and whether or not we are kind of have a handle on that, or we are ahead of the curve. If you could just speak to that, before we get out of here, are we ahead of the curve, or does the new mandates create new challenges?
Thank you, Chair Miller. I'd like to speak to the vaccination rate of the city's workforce. When we're talking about being ahead of the curve, the vaccination rate for New York is about 70%, and the city's workforce is about 94%. So again, thereby paving the way. Of course, city workers are at the forefront of being vaccinated and doing what they need to do to keep themselves and their families safe. I can turn it over to my colleague at the Department of Health regarding other information.
Yes, we have been seeing the cases increase over the past month or so, and as of this morning, we have a daily case total over a 7-day average of about 2,400 new cases per day. So we have very high levels of COVID-19 transmission. And yet we're also keeping our city workforce safe with the vaccine mandate and with the other types of mitigation strategies that we've talked about today.
Have we identified where they're coming from? And I know that at 5 p.m. today, my staff is always on the call, and folks have dropped in and out, but we've been consistent. We always want to know when and where this is coming from so that we can get real-time information out to folk. And are we seeing a particular surge in specific communities?
We're really seeing it increase citywide, and we do update our website daily around 1 o'clock in the afternoon. So, there's a lot of information on the website, but at this point, we are seeing it citywide.
Okay, and for DCWP, are we anticipating that we'll see in the general workforce the type of vaccine compliance or numbers go up in the way that the city's workforce has when it comes down to the economics of associated with terms and conditions of employment?
Thank you for the question, Chair. DCWP is one of several agencies that are part of the city's recovery efforts. We lend our enforcement staff to key to NYC, but we're not the arbiters of that program and the new mandates, and I wouldn't be able to speak to how compliance will work going forward. But what I will say is that, and as I alluded to earlier in my comments, is that this city has been ahead of the curve. While other jurisdictions nationally were scrambling to deal with their private sector workforces and having paid time off and waiting for Congress to act, this city had paid safe and sick leave laws on the books since 2014. We have protections for essential workers, predictable scheduling. We have protections for freelancers, all these different workers that in varying ways were impacted dramatically by this pandemic, and that has assisted and made us ahead of the curve in terms of our recovery, not only from a public health standpoint, but from a dignity standpoint as a worker in New York.
I want to thank you all for putting up with the committee for the last nearly 2 years now, unfortunately, that we've been here, and not just, and that is during the COVID-19 pandemic. But on a personal note, on behalf of the Committee on Civil Service and Labor, I want to thank you all for your service. I want to thank you for your partnership over the last 8 years that we've had the honor and privilege of working with many folk in the room. And I will say, and it's not for me to say, but I think we left it a little better than we found it. And that is, the teamwork makes the dream work. And I know that we can be a little tight from time to time, but we always try to see things from the other side of the table, from both sides of the table. We try to be fair, and we really value the partnership. So thank you so much, and it's been a pleasure working with you all.
Thank you, Chair Miller. It has been a pleasure. And again, I definitely agree with you that this partnership has been quite productive over the last years, and we wish you well in your future endeavors.
We will now hear from our public panels. And the first panel,
Helen S. Jarrett,
Helen Jarrett,
Daniel Krupp,
Daniel Krupp,
and Irene Liu.
and Irene Liu. Hey, sir. Good now afternoon, and I want to thank you all for your patience. I hope you all were listening attentively to some of the statements and questions and answers from the administration. And but certainly I want to hear from those representing the workforce and what has been done, what needs to be done as we move forward. And so with that, please identify yourselves and you can begin your testimony. Please.
I wanted to see if the mic is on.
Just push the button there, the red light. There you go.
Okay, yes, it's better. Good afternoon, Committee Chair Miller, committee members, and City Council members. My name is Helen S. Jarrett, and I'm the Mobilization Coordinator and an Executive Board Member of Communication Workers of America, Local 1180. I am here today testifying on behalf of President Gloria Middleton, who at the last minute was unable to attend and sends her apologies. CWA 1180 represents almost 9,000 active city administrative and private sector workers and close to 6,000 retirees. COVID-19 safety protocols in the workplace has become one of the most important topics for union leaders as our members return to in-person work. It goes without saying that the transition back to in-person working has not been an easy one. Despite many rules, regulations, and procedures, a great majority of the members were still scared to return to work. Our phone lines were flooded daily at the start, and our emails continue unbounded now with members who have questions and concerns. To this day, members continually report of instances where the city mandates are not being implemented or implemented enough. You have asked the question, is labor working collaboratively with the administration on updated in-person workplace policies? I believe the more appropriate question to ask is whether the current city administration is working with us. Pardon me? Are they working collaboratively with labor or on updated in-person workplace policies? And we all know the answer to that. It's not a matter of whether the current city administration has communicated critical workplace policy updates to the municipal employees. After all, we all know that the mayor has definitely communicated critical workplace policy updates from a podium in front of the media with zero warning to the entire New York City labor movement. Remember that? I am not sure one would call that, quote, effectively communicating to the labor movement. However, the bottom line is that bringing 350,000 plus municipal workers all at once, in most cases to close, confined working spaces without having included labor on policy implementation was wrong. And it has now led to the serious, I understand the buzzer went off, I just want to finish up, and it has now led to serious issues. While I would give you dozens of examples in my union alone, time does not permit. So I will just give you a couple of instances in which the city's so-called reasonable accommodation scenario did not even work during the peak of the pandemic. It didn't work then. How can we expect it now? In April 2020, a member of our workforce who was pregnant at the time and working at Woodhall requested a reasonable accommodation to work from home or another location. EEO, in consultation with her director, denied her that accommodation despite H&H having others who work from home who did not request a reasonable accommodation. While this member's work have been performed from home, EEO said it would have caused a burden to the department. She ended up having to switch departments unbeknownst to her director, to have a safe working environment. Another one of our members have been charged by Woodhull Hospital, also H&H, with being AWOL since May 2020. While the job of wearing a mask she almost passed out and was sent home by the Employee Health Services. She returned to work with a note with her doctor stating that she was unable to breathe while wearing a mask for the entire day. Employee Health Services did not clear her to return to work, and she was again sent home. They told her to apply for reasonable accommodation, which she did. It was denied because of unstated conversations that the EEO officer had with her director, although the denial email said it would have been a burden to her department. Her job to review charts from a computer program, as well as that she is now how exactly is that a burden to the department if she reviewed charts while teleworking? We fully understand the scope of what's involved in preparing and maintaining all of the buildings and offices, the HVAC and water systems, the restroom and elevators, hallway, workspaces, shared spaces, reception areas. Monitoring face coverings and health screenings, notifications and quarantines, and everything else that's involved in living and working with the pandemic. But this is exactly why unions should have been involved in the initial planning stages, how and when the municipal employees were going back to work. And honestly, if the city was able to fully function with a great majority of employees teleworking during the peak of the pandemic, then there is no reason it cannot and should not consider some form of hybrid teleworking scenarios, how to minimize the number of employees working side by side in confined spaces when new variants of COVID-19 continue to pop up, infective even more that are fully vaccinated. As political leaders, as government agency leaders, and union leaders, we have the responsibility to make sure those we represent were taken care of and protected while on the job. We can no longer continue to operate under the business as usual method. If COVID-19 has taught us anything, is that we must start thinking outside the box if we're going to succeed and thrive. Thank you all so very much.
Good afternoon, Chair Miller. Thank you for the opportunity to testify today. My name is Irene Liu. I'm a policy analyst at the Community Service Society. We have supported the expansion of protections for low-wage workers, including a key role in efforts to pass the paid sick days law in New York City. Today, I'll be testifying on the need to improve public outreach around the city's paid, safe, and sick leave law and to expand paid sick leave to app-based gig workers and other misclassified workers. These measures are key to reducing the spread of COVID-19 in the workplace and protecting the public health of all New Yorkers. 7 years after the city's paid sick days law went into effect, data from our 2021 Unheard Third survey shows that 42% of low-income workers covered under the law say that they still don't have paid sick time, more than double the share of those with moderate to higher incomes. Covered low-income workers least likely to have paid sick leave now are those facing the greatest risk for contracting COVID-19 or for being denied their rights. These include part-time workers, immigrants, those employed in face-to-face industries such as hospitality and construction, and those working for smaller businesses. Low awareness of the city's paid safe and sick leave policy has persisted and may be preventing New Yorkers from exercising their rights under the law. Half of low-income workers we surveyed still haven't heard about the law, and this includes 47% of workers in face-to-face industries and 52% of immigrant workers who are unfamiliar with the law. Part-time workers are also 3 times less likely than those working full-time to have heard a lot about the paid sick days law. As DCWP mentioned earlier, since enforcement is largely complaint-driven, workers unaware of their rights are much less likely to file a complaint against their employer. And DCWP talked earlier about all that they've done to ramp up their outreach enforcement, but we think that more should be done, and we recommend that they continue to prioritize outreach enforcement for smaller businesses and those in face-to-face industries to ensure that employers are aware of the law and in compliance. And we also urge the council to pass Intro 1797, a bill that would require DCWP to produce posters for voluntary display at pharmacies and healthcare locations around the city, informing New Yorkers of their right to paid sick leave. The bill would also invite the New York City Health and Hospitals Corporation to distribute and display these posters at their locations. These locations are a key interface point where workers can access healthcare, COVID-19 testing, and vaccinations, and they can be made aware of this fundamental right, especially during a pandemic. And we also urge the council to pass Intro 1926, which would expand the definition of an employee under the city's paid sick leave law to cover gig workers and other workers misclassified as independent contractors who have been excluded from this important workplace standard. Our Unheard Third survey found that 54% of respondents relying on app-based gig work lack paid sick leave, compared to only 24% of employees without this key benefit. This essential workforce has suffered the consequences of working without paid sick time during the pandemic. Nearly 4 out of every 10 app-based gig workers we surveyed last year reported that they or a family member had been infected by COVID-19. Thank you. With the new COVID-19 cases linked to the new highly contagious Omicron variant of COVID-19 surfacing the city, raising awareness of the city's paid safe and sick time law and expanding coverage to gig workers and other misclassified workers is more important than ever for preventing another surge of COVID-19 infections this winter.
Thank you, Ms. Lowe.
Thank you.
Good afternoon, Chair Miller, and happy holidays to all. My name is Daniel Krupp, and I'm the newly elected president of the Association of Legislative Employees, or ALE. ALE is the New York City Council's union, representing nearly 400 staff. We are the country's largest union of legislative aides. We present this testimony in solidarity with all workers, in particular our public sector union siblings who have served New Yorkers with courage and dedication throughout the COVID-19 pandemic. Like workers in transit, healthcare, whom we've heard from today, grocery stores and schools, council staffers also played our part in keeping New York City running during the darkest days of the pandemic. Member aides have provided direct services to thousands of constituents in need, as well as vital legislative support. Finance analysts supported passage of 2 balanced, on-time city budgets. Staff were infected with COVID during this period, and tragically, 1 aide died in April 2020. It's important to note that many member aides have been reporting to district offices since July 2020 to serve our communities, some working 5 days a week in person. We extend our thanks to Speaker Corey Johnson and his team for their ongoing cooperation and dialogue with ALE. We applaud the Council's more careful return to the office for central staff, unlike Mayor de Blasio's rushed return for city workers, which has led to burnout, an exodus of talent from city agencies, and the feeling of unsafe workplaces. Looking forward to 2022, our top priority is building a strong line of communication between the next speaker and every council staffer, whether they work in district offices or 250 Broadway. We are one council community and should have one set of rules and standards that is clearly communicated. The next speaker should ensure that every council staffer has received a copy of the most current COVID health and safety plan with a clear way to raise any issues or concerns. The council's vaccine mandate demonstrates the speaker's authority to ensure health and safety for all staff. With this authority established, the Speaker's office should partner with ALE to update and communicate workplace safety rules, monitor implementation, ensure accountability when issues arise, and transparently report back. No one council member office is an island. Union members and shop stewards in every office can and should be allies in COVID safety. Joint union management safety walkthroughs in offices would also be a smart step, as 34 new council members begin next session, and the Omicron variant is spreading rapidly worldwide. ALE also encourages the council to pursue voluntary alignment with the New York State HERO Act, which helps control airborne transmission of COVID-19. Although the public sector is excluded from the act, agencies in the council should voluntarily adopt these standards. The city owes a huge debt of gratitude to public servants who have served New Yorkers throughout the pandemic. As collective bargaining agreements come up for negotiation, the city must take swift and serious action to support us. That means prioritizing at minimum cost of living adjustments that keep pace with 6.8% inflation, the highest in my lifetime, and full staffing in agencies and council offices depleted by hiring freezes and attrition. One positive from the pandemic, and there have been very few positives from the pandemic, but this is one, has been the shattering of the old norm of 5 days a week in the office. An internal ALE survey showed overwhelming support for maintaining at least some ability to work remotely. At the same time, there's no substitute for certain in-person activity, which requires strong safety guidelines. I urge the council to support caregivers, promote mental health and well-being, and ensure continuity of operations in the face of any future emergencies by formalizing remote work policies next session. On behalf of ALE, we look forward to a continued dialogue with you to ensure that the New York City Council leads from the front on workplace health and safety and helps advance that mission for workers citywide. Thank you, and I'm happy to answer your questions.
Thank you, Dan, and congratulations, and look forward to great things. So I do have a few questions there, and so Ms. Liu, what do you think you can contribute this lack of compliance in the private sector workforce to?
I think it's just, I mean, sorry. In terms of lack of compliance, as I mentioned in my testimony, I think a lot of it has to do with awareness. So, DCWP, as they described, they're doing their best during the pandemic to really, try to do things virtually, but I think it's harder now. I think it was already a challenge before the pandemic to raise awareness with so many workers, private sector workers scattered at thousands of businesses across the city. But I think it's employers don't really understand the law either. I think I know DCWP is also trying to raise awareness of this too. But I think given all these amendments that have taken place and understanding which of their workers are covered, and especially with all the federal and the statewide paid sick leave regulations, I think there needs to be more public education, for both employers and employees. So I think a lot of it is due to awareness and kind of misunderstanding of the law.
So on the New York City side, is fairly simple. More than 5 employees.
Yeah.
And what the responsibilities of the employer. The employees are in terms of accruing hours, right, and how that happens. But do you believe that there are folks who, for whatever nefarious reasons, choose not to be in compliance or to skirt around compliance, or is it just a lack of knowledge that, and if so, I know that they, in DCWP's mind, they had a robust rollout, and I know in some of the areas, that I did some work with the then chair or director throughout the city, and kind of going into certain business districts and having conversation with small businesses about what their responsibilities were, and making sure that information was posted, properly posted, so that employees would have the proper information, whether or not that was in the proper language and otherwise. I'm not sure, so again, just wanted to hear from you on the ground. I don't believe one of the things for sure is that they have the depth and the capacity of the workforce to reach the magnitude of workers that are out there specifically, because we're spread out, different industries all over the place and all over the city. Any suggestions about how DCWP in particular, the city, does a better job, and all agencies that are responsible for providing resources and services to the city's most valuable and vulnerable workforce? How do we get this? How do we reach our target audience, right?
Yeah.
Because with the best of intentions, we do great things, and sometimes we're just not reaching the people that we want to reach. what would you suggest from your view on the ground?
Well, I'd just like to reiterate again our support for 1797. I think it's reaching people when they're paying attention at the right time. That's why we, kind of focus on health, healthcare locations like health and hospital sites and pharmacies and, pharmacies and doctors' offices. 'Cause that's where so many New Yorkers, a lot of workers, are still, going to get information. And that, if they're in the waiting room, for example, waiting to get their, child vaccinated, or to get tested for COVID, they'll look at a poster and see like, oh, at least they'll have some understanding or awareness of it. I think, based on our previous research and what we've seen, a lot of people have awareness of the minimum wage. Compared to overwhelming awareness of a $15 minimum wage in New York City, and we want to get to that point with paid safe and sick leave. We showed that our data also showed that between 2014 and 2017, when DCA or formerly DCA, now DCWP, really ramped up its public education efforts, had it, on the subways, and, was very widespread. The share of low-income workers who were covered under the law said that they received paid sick time went up to 71%. It was a huge drop. So, since 2017, as DCWP, it wasn't as visible, I think, since then, even though they've been doing more targeted outreach. We saw that share drop to 58% of low-income workers covered under the law so that, they have paid sick time. So I think it's getting to that point, like very widespread awareness.
So you say they had a better marketing plan for rollout than
Yes.
they did for implementation
Yes.
and compliance, particularly in the midst of the pandemic,
Yes.
and that they should spend a couple of bucks on public awareness.
Yep. Yeah.
Okay.
That'd be a recommendation.
Yep. And Ms. Jarrett, from what you mentioned was very nuanced about your membership, right? And those are the things that matter, right? Because again, as we say, public policy happens by virtue of public discourse, right? We're not talking about it, we're not fixing it. Was 1180, by virtue of their membership to the Municipal Labor Council, what did those conversations look like at the MLC, if you know? Were they with the leadership? And I mention that because my good friend and mentor, Arthur Childs, for a really long time, chaired the health committee of the Municipal Labor Council. So therefore, 1180 obviously has that relationship, intimately familiar with that. Was there a broader conversation with the leadership of local unions that may or may not have trickled itself down, or are they, does the MLC in those cases, are we sharing the needs and the values of the workforce? And so therefore, listen, whether I'm in the supermarket, jogging the neighborhood, church, synagogue, mosque, wherever I am in district and throughout the city, those conversations come with me to City Hall, right? They shape public policy, they shape budget, because they are clearly the needs and the values of the people that we represent, lodged in the subconscious. And when we're engaging in policy and budget and these conversations, I bring those conversations with me. How does these policies reflect the Municipal Labor Council's broader workforce, and then specifically 1180?
Unfortunately, I'm unable to give you a precise answer because I was not at the table and I'm sitting in today for President Gloria Middleton.
Just, because I know early on when even I was intimately involved in the return to work, not even long before the return to work, for those who were working, who was going to be tasked with coming into the office, how do we define what critical services were required that people needed to come in, what type of workplace safety and protocols had been put in place, those kind of conversations, should obviously include the persons that are delivering the services, right? One of the questions that we asked to the administration was about the health and safety committees, right? Every agency should have a health and safety committee based on everything that long before COVID and hopefully long after COVID, we're gonna have to keep the workforce safe, right? And so the type of discourse and engagement that happens specifically within those agencies, industries, locations, that conversation has to be ongoing in order for us to produce the best product, to produce policy that keep people safe. And I will say this, and this, this is us in the room, this is labor in the room, that we have gotten away from, the fundamental tenets of organized labor is workplace safety, right? It is about that canary in the coal mine. And there have been time and time again, the illustration of the workers in the Board of Election who were never taken out when they took out the other agency people in the same building. And they just stayed there until they began to die off, right? And people working triples at no matter what your facility, your title, or your job is. At what point is it okay for people to work a triple tour, not in the midst of a 1 day or 1 week catastrophe or emergency, but ongoing, right? And then we sit here and debate the merits of that, or whether or not people are gonna call out sick, or which came first, the chicken or the egg, right? This conversation is for us because never forget why you're there, right? Financial compensation is important, but you gotta be, the best ability is availability, and you have to be able to show up. They will get you in the room, they will get you behind the desk, they will get you behind the wheel of the bus, they will get you on the beat, in the fire truck, or whatever they need to do, because that's their job. How you perform that job and service, and we are all public servants, is really up to us. But we need the tools and the resources. And number one, you need to be able to do it effectively and safely, right? I need for us to really understand, specifically, Dan, I'm grateful for your efforts. I want you to stay laser focused. I want you to, as you mentioned, that, the dialogue between the next speaker and Ale is going to be vitally important. Some of the things that, look, it was a lot of talk about working remotely, return to work, and here's what I know from my staff, for communities, particularly communities of color, that were super devastated, like just fire trucks and ambulance, and you don't want to pick up the phone and no social media because people were sick and they're dying. And we were being told, just stay in the house. Nothing you can do. Just stay in the house. And there were 2 New York cities when it came down to that. But in the midst of all of that, people know their local council member and their local elected, right? So what do? I can't crawl into a hole and hide. I have to be able to perform these services, give answers, lead. One thing that has not happened, no matter what industry you were in, there had been no previous professional development around remote learning, right? Or remote service delivery. How do we, right, as we transition? Because it's okay to say that, and people, listen, I can tell you from real experience, my staff was phenomenal for the first 2 months, maybe even 3 months. And then it kind of weighs off, right? The adrenaline is not flowing in the same way. We're not being responsive for them, because there's some real-time stuff happening, right? But after that, there is a specific skill set that is needed to continue to deliver those services that I don't think any of the New York City workforce had been prepared and trained and develop for, right? So workforce development is going to be crucially important as we move forward, right? Because our value, the value of your membership, is in the services that you deliver. It is in the people. No one comes to New York City, no 65 million people come to see the mayor or the speaker or me or you. They come because New York City's workforce is the greatest workforce on the globe, period. Right? Obviously I come from transportation. As much maligned as you go out, and there's none, not London, not Japan. No one has the 24/7 transportation system that we have, the healthcare, the education, all these things that we as New Yorkers take for granted is the reason why people show up, right? How do we support the workforce in better delivering those services safely? Because the people that have to leave their home, right? You looked at the data, majority women, majority black and brown, that don't have the luxury of working from home, right? That are out delivering these services who potentially infect themselves and family and community. How do we, it's a tall order, but that's your task. That's your task, because the people sitting on this side of the table, on the management side of the table, their job is to make sure people show up and do whatever. Your job is to keep them safe. Could we just speak to safety?
Sure, if I may, Chair Miller, and thank you so much for those comments. I certainly agree with you that New York City has an incredible workforce that's represented in part by the panelists here and many workers, some of whom are unionizing now, and I'd pay tribute to the workers at the Starbucks in Buffalo who voted to unionize. It's not just public sector employees or workers, right? It's workers who are non-unionized, workers who are in struggle to get organized so that they can come to the table and negotiate with one strong voice for workplace health and safety. And when I think about the history of the labor movement, really, health and safety is our issue. Health and safety is what marked the uprising at the Triangle Shirtwaist Fire Factory. It is a hallmark of what the Teamsters struggled for in the 30s, and really what AFSCME started organizing around at the beginning, right? Which is some real workplace standards that impact everyone and touch everyone and are applied equally and fairly and raise the professional quality of the services that we deliver when you look at the public sector. And I do think that what you said very early on in your opening statement, I believe, around communication really is a critical part of this. And there can't be anything for workers without workers. We need management to understand that we are not ancillary to the creation of high quality safety plans. We are central to it. And that means that workers are at the table, workers are shaping the policies, and as we see with Omicron now, which shows its ability to get through the vaccine, we need to be at the table to revise these workplace safety policies. We need to look again at things like masking, at social distancing, and again, to take on your point about the remote work question, I think remote work is critical because, be it many tragedies from Superstorm Sandy to 9/11 to now the COVID-19 pandemic, there are lots of reasons why in the private sector, remote work has now become quite normalized. It's for business continuity reasons. And while we really pay tribute to folks like nurses who have been doing their job day in and day out in person because they need to be there beside the bed of patients to take care of them, we know that there are other public servants who actually, there's some interesting studies that say productivity has increased working from home because you no longer have commutes. You also have the positive externality of less environmental degradation or pollution or traffic. There are lots of things that kind of come together, but certainly just to close, the digital divide is central to this. And I really want to recognize and honor the member aides in particular who were out during the height of the COVID pandemic, handing out PPE, going to nursing homes to hand out PPE, going to community events, making sure people were aware what was going on, of services like Get Food that provided home-delivered meals to people who could not leave their homes because they had come into contact with COVID-19 or were infected. And I think we have to close the digital divide in this city because everyone needs access to online tools. They are essential, and we certainly hope to be a partner in making sure that on the workforce safety side and the workforce education side and access side, that there are those tools of technology available to keep people connected and to provide that hybrid flexibility that will, I think, put New York City's public sector workforce on very strong footing for whatever disasters or emergencies come forward in the future.
And so I'd like to follow up on conversations about what that may look like. Just consider me a resource as well. And thank you for your service again. Congratulations. Anyone else want to tackle that one?
I would like to echo everything that he said. That was phenomenal. One of the things that you just mentioned was about the PPE. We had one of our members, I don't know if you know Priscilla Carroll from
Of course.
Elmhurst Hospital.
That's right.
She rocked our foundation.
Everybody knew Priscilla.
The day when we found out that she passed away, and she was simply handing out PPE. I remember when we did the street renaming for her in Queens, it just reminded us of who she was, what she did, and how deadly this disease is. With regards to the education, schooling, I am glad to see that the Buy Back Better Act, that is going to help tremendously with broadband, because we know a lot of children in New York City did not have that at their fingertips. And I'm talking specifically about Black and brown and minority children. Also, I would like to echo the fact that I would say that health and safety is the most important thing. Me personally, daily, I speak to our members, literally call them on the phone, asking them, how is everything going in your workplace? How is the air flowing? Is it flowing smoothly? Are people wearing their mask? Are they doing social distancing? Are they cleaning and, disinfecting? And the majority are saying yes. The 6 feet has narrowed down a little bit, but people are wearing their mask. Unfortunately, people have to be called out when they're not wearing their mask, and they have to, management has to speak to them about it. But for the most part, they're adhering to it. However, it would have been best if, like they said, they had spoken to the labor force before the hammer was put down, indicating that everyone must return to work. We're dealing with it. We would have preferred if it turned out another way, but we are working with it.
I also, and that's big picture, obviously, that policy, but, implementation and how things get done actually happen on the ground. And so whatever your particular location, locality, where your members are, and each locality should have its own safety officers or safety committee. Make sure that they're absolutely active. And there are times when management tries to get too busy for the monthly meeting, and that can't happen, right? Because the health and safety of our members and the people that you represent, that's your charge. That's your first and that's your primary charge. It's keep people safe, right? And so make sure that you're in the room and wherever possible, and having those conversations, and that policies reflect the not just the values and the needs of the workers, but the expertise of the people that are on the ground that are delivering these very specific services. No one knows your environment and your surroundings better than you do. Why let someone else from the towers decide what you need? That shouldn't be the case.
Yeah, I just wanted to add to that CWA 1180, we are in the room. Our staff reps are at the table for these health and safety meetings across the 66 mayoral plus agencies that we represent.
So thank you all. Thank you. If there's any parting words I want to say to you all, as I said to the admin, it has been absolute honor and a pleasure to sit in this seat, of which I have for the 8 years that I've been in the council. And there's options, and people don't consider this to be very sexy, and this is where I spent all of my adult life, working on behalf of workers and being a part of this movement here, and having the opportunity and the honor to represent workers. and to lead this movement in whatever capacity. It's has been an honor, and for all of you, you know, just consider me to always be a resource and a partner. So thank you all.
And we thank you for your service, sir.
Thank you, Chair Miller.
With that, we have no more panels?
No, that's it.
Hearing is adjourned.
Because I was reading about AL, you know, as they were forming unions, what have you.
Can I give you, what will substitute as my business card? 'Cause